glasses every 10 minutes.
That is fancy medical one. See if we match it up. Well, usually helps if the darn thing turns on.
Probably got another one
There
in
it
that
is.
thing over there, maybe.
Shh. Man, it's hard to make him not talk.
You'd be the first.
I don't think
Patty
he-
used to work.
Okay, I can find one of those.
I've heard.
Wow, they are different. Yeah, give it a minute. All right, why don't you take some deep breaths? Just slow, you don't have to breathe fast. Take some good breaths. Just slow, you know.
Don't get higher.
Oh, I did, but it's okay. I'm not sure I believe that number.
Don't look at it for a minute.
Mm-hmm.
Just don't pay attention to it for a minute.
Wake me up in a minute.
I think we got him quiet for 2 minutes. I should time that. That might have been a record. I'm just trying to believe this. Because if I'm 83, we're in trouble. This is interesting. It's working.
Maybe it's my tough skin. I don't know.
No, because yours. So I would say, let me see your CVS one. See how far off we are. I think you're about 2 to 3 points off from this.
I think in my other one, I don't know if I have it. I left it with that. I must have it at the motel. I have another one. Probably one down there in the truck too. I had several around.
So you're off by about 3 points. 3 points higher. So I would say when you look at this, it's 3 points lower.
His is 3 points
Oh,
higher.
no,
Yeah,
No, his is 3 points higher,
His
yeah,
monitor is 3 points higher than hers.
okay.
than the medical one. So I would just keep
Okay.
that in mind when you're looking at his stats. 88's the magic number. Anything 88 and above, we're happy with. Anything below that, I'm not happy.
Do you hear that, Papa?
So that means when you drop down to
When you-
80 in the truck the other
When
day,
you
you were
use
really
yours,
77.
anything above 88 is good.
Yeah, 88's the magic number. Okay, so here's what I'm gonna recommend. I'm gonna listen to you, but I am gonna put you on a steroid taper for about 2 weeks.
okay,
I'm gonna start the prior authorization for, Esbriet, which is 3 times a day.
just do a drip, like I can put it in the line myself or what? You talking about like a drip in your IV?
No, the Esbriet, it's a pill.
Oh, okay.
They're both
I just
pills.
heard drip, I thought.
No, we're gonna do the prior authorization.
Okay,
Cause it's a drug that is not in the pharmacy. It's a mail order drug, it's a specialty order drug, but they both are. So we have to do a prior authorization, and then what they do is they will call you and they'll set up delivery times, cause they don't want it sitting in the sun
I
either.
think we did one that way before, I believe. I think we did one that was, don't remember what, I'm just thinking we did one.
Yeah, so we'll do that, and the way that drug is gonna be taken is 1 pill 3 times a day for the first 2 weeks. Let your body get used to it.
Okay,
Then we bump it up to 2 pills 3 times a day for 2 weeks, and then we go to 3 pills 3 times a day. Once we get to that full dose, as long as you're tolerating it and doing okay, then I can switch you to a single pill 3 times a day. Which is so you don't have to take so many pills anymore. But
3 times the strength?
no.
Just,
It's the same strength, it's just that a lot of times the side effects people have are reflux or nausea or tummy upset. So starting at the lower dose and just building up usually lets people tolerate it without the side effects. Now,
Okay.
because you live out west, you got a lot of sun. You do have to be careful. 9% or so of people can get what's known as a photosensitivity reaction, meaning you can get a rash from the sun when you use this drug. So we generally recommend that you wear sunscreen, particularly when you're going outside.
they wanted me to do that anyway, because
Yeah.
we're the #1 place for skin cancer in
Good.
America.
So anything above an SPF of 40 is fine.
I usually
you wanna
use
go-
100, so,
That's fine.
yeah. it's-
So make sure you're wearing sunscreen when you're out in the sun. And that's, the biggest side effects are usually the GI side effects, the stomach, and potentially the sun. Now, I'm gonna give you 2 other potential ones that if they happen, it's probably the drug, and call me. Some people can get anxiety on it, just feel kind of anxious, not that anything's happening. I think I've seen it in 3 people since I've been doing this drug in over 10 years, but it can happen. And some people get a change in taste where food just doesn't taste very good anymore, they just don't feel like eating. So let me know if that's an issue as well. Let me know about any issue.
Same drug does both, or 2
Yeah,
different drugs?
no, I'm only talking about the one drug now.
Okay,
The one, the cheaper drug.
So, but
Okay.
how long do you think it will take while taking this drug to clear up any pneumonia or whatever inflammation that's still in there or could be in there?
I'm gonna hit him with some prednisone, that works pretty fast.
Okay.
That's like days.
Okay.
So we're gonna hit that one pretty fast. This one is more of the kind of long-term marathon drug to help prevent any
Doctor,
progression.
So it's just stopping
she gave me
Stopping.
something,
Actually, let me rephrase, slowing.
slow. Okay.
she gave me something, she said that they didn't have before, and it knocks COVID fast. I'd have to see what it was.
Paxlovid, the drug I would have given you if you called me.
Okay, so we did, if one's giving me something for something there, you need to know.
Well, that drug
Yeah.
works, you need to, like Tamiflu, you gotta take it within the first 5 days.
Yeah,
Otherwise, it doesn't work. So what we're gonna do. Who do you see tomorrow? Oh, let me see. Dr. Wen, great. We love Dr.
Do they actually do transplant in this building or just this area?
The actual transplants are done across the street
Cause I
in the hospital.
got checked for my back, my hips and stuff. I get checked in the building, then something else will be over here. I said, they said, "Where did you go to?" Says Baylor Scott White. What Baylor Scott White? They don't have a Dallas is Baylor Scott White.
Yeah, it's like the third largest medical system in the
Yeah.
state, I
It
believe.
is. It's just they were
Or
coming in.
country,
And,
which-
well, this is Baylor Scott White. I said,
Tell them you went to the big center in Dallas. There's only one.
one
We are the main center for everything, pretty much.
10-4.
This is it. All of it happens.
Well, I figured,
All roads lead to Dallas.
but
At least for
I've
the
been
Taylor Scott
judging
White.
by my opinion of your kind of quality. I figure this is one of the best. It's
We try.
yeah, 10-4.
All right, young man. Oh, cough. Do I need more of that cough syrup or no?
Well, I just generally let it go over. I picked up some cough medicine.
Okay, is that working?
Mucinex. Well, yeah, I usually take it. It's not something I'm coughing so long. I guess when you just get used to pain and aggravation, till it just hangs on a while.
See,
You
you
just
don't
act like
pay
you need that.
attention. I'm willing to bet everybody around you notices it, but
Okay.
you probably don't.
Well,
Which
I
is usually
just,
what happens.
yeah. I'll try to watch how much I cough. Certainly people around me probably bother more than it bothers me. I don't like it. My concern is, as hard as I'm coughing, if I'd break something loose, it's
You really haven't coughed that much. I mean,
that hard,
Good.
yeah.
Well, it
just
makes
like
me
you did
think
while-
if, you
like
know-
you did a little bit earlier. And
When
do
Odessa,
it
if
all
they
the
told
time.
you you're gonna cough all this stuff up, well, you can't cough up. If you don't have pneumonia still or remnants of pneumonia, then there's nothing for you to cough up,
That's
right?
right.
So,
That's the reason I couldn't understand when they kept saying, well, boy, next week, and then next week, I've done another week, and I still ain't, you will, I'll fix this thing.
Because they were seeing your pulmonary fibrosis and calling it pneumonia,
That's
which is,
what
I
I was
see this
trying-
all the
I
time.
tried to tell them, I said, I think you're trying to treat something that I don't have.
so are you taking x-rays today?
Yeah, right here.
Okay.
We have one in the clinic. He doesn't have to go anywhere.
But you can look at it and you can differentiate between,
better?
this is
Yeah,
the,
I'll compare it to his other ones.
Is it better before or after I've eaten? Y'all got a pretty good cafeteria here, so.
So guess what? The X-ray machine's on the way to the cafeteria. Take a
Okay.
pit stop at the X-ray and head
You
out to
got
the
her
cafe.
all, yeah.
You don't even have to leave. It's literally 20 feet down the hallway. Okay, we're gonna do the prednisone taper. Yeah, let's do that. 6.
you get it too.
oh, so bad.
Did you have 2 or 3 questions that your mom wanted,
I've got them.
He's got it.
or is it something?
I'm listening.
She's already answered
Okay.
at least
Sure.
one of them.
I thought you may have.
She asked about if you'd be better on the tank, which she answered.
Sounds like you need to
earlier.
be on the tank.
And then I'll have to. This will. No, you're recording anyway,
Yeah,
so
we'll
I
be
might
fine.
miss a little bit. It was. Is it okay to remove the oxygen when he walks to the bathroom or kitchen, or does he need it continually, 24/7? Which are the
Depends on
tank.
how far the bathroom and the kitchen is.
So that's.
You know,
that's
like-
What,
on you.
100 foot from your recliner to the bathroom, probably?
Yeah,
Well, and if you're using that, you walk a lot easier when you use that,
yeah.
which will
I
have
use
something to do
it
with
now.
it.
Probably okay.
I've never figured, for the last 2 or 3 years, I walk through the house and I'll take big steps. I take it away and I'm walking like a Chinaman. And I said, what is it different? I can't tell you. I just know when I'm walking with this, I kind of glide and the pain is less. Now, I had pain this morning, that 6-minute walk. my arm started hurting, some in here, but it was so excruciating here. Is that normal? The pain in my arm? I told her, cause I had my hand.
Hey, stop it. 10 steps back. What do you mean pain in your left arm when you're?
Both my arms here, if I go around in a grocery store with a cart, hurts, so I lay on the cart. But when I was doing it, I told her, my arms are hurting really bad here.
Any chest pain?
Did you want now?
Chest pain?
No, I didn't have chest pain. It's just in my arm.
But you have
Little
arm
here,
pain.
but mostly here to here.
Oh, you're just gonna cause me trouble. All right.
What I do, just switch myself over to the hard section. And I've had doctors tell me they want to trade hearts with me, but
I don't switch you to anywhere. I just figure it out. I'll switch you when I figure it out. But if I haven't figured it out, I'm not switching. Okay, what I need to get my hands on is you had an echo. Where's the report?
So, but your arm's only hurting when you're putting your weight on the walker?
somewhat it does.
Does it ever
But
just
I try to
happen?
Lean, I can't, like the leaning forward, takes all the pain out of my back and all, but it puts it in my arm, mostly here.
When was your last chemical stress test?
You talking about like on a treadmill?
You know, like they inject you and then they do
I
their
don't
medicine
remember
stress
having one.
test.
I don't remember. I used to get on a treadmill because I had so much trouble with my legs. I couldn't finish more than 7 or 8 minutes. I had to
Well,
strain
that's
it.
why the treadmill's not helpful because
Yeah.
frankly, then it's not.
Yeah.
They just like give him adrenaline
Well,
or something.
mine did all right.
Yeah, it's
Maybe
not,
not adrenaline,
well, it's
I
not
don't know.
adrenaline, but the concept is that actually, is
Just
that
kick your
it's
heart
a-
rate up with a drug.
You know,
legs
like
on the
the
table,
feet are-
kick it up, and then put
what
it
would
on
happen
put
is
your med where we can actually
They
see
start
the flow through the
elevating that
vessels.
1 degree,
Yeah.
and when they get 2 or 3 degrees, man, it just start killing my legs. I had the vim and the vitality goes with my legs.
But so you said your arms hurt when you're pushing something or when you lean forward to take
Lean
it off your back?
If I go to the grocery store pushing a cart, do the same thing.
But it also does it when you're just sitting down and you lean forward?
No, I haven't noticed.
So it's only when you're
It's doing
using
it
your
right now,
arms.
but the doctor told me the other day I need to see a chiropractor about this up here right at the base of my neck. That could be tied
So you like
together.
pinched a nerve or something? That could be
I
it.
don't know. My gosh, I mean, how many more things can I get? I don't know.
Okay, that's a
Don't-
question you should never ask.
Don't open that
Yeah.
door.
Leave Pandora's box closed, please.
Yeah.
It's Monday morning. I do, well, it's not Monday
Yeah,
afternoon.
I think you're right.
Time for me to
I
get
hate
you
to
out of here.
Knock
Okay.
on wood.
Please, do not open
The
Pandora's
other one
box.
she
I
wanted
need-
me to
I
ask
need
was
my shirt off.
if he should be on like a scooter or a wheelchair.
I need my shirt off.
Because the minute we do that, it decreases his exercise
You,
tolerance.
you
and I
need
don't
all
know
them
what-
metal stuff out at least
For,
for an X-ray.
No, I think
yeah.
he's talking about taking the shirt off
Okay.
just so she can
I'll
listen.
take my shirt. I didn't know if she needed.
No need to take anything off, just, you know,
That's a
just
good
like
answer
lift
about
up.
the wheelchair.
Alright,
Nope.
do that.
I'm almost waiting
And
for
all
him
you
to
need
leave
to do is-
that.
See, that's all I needed. You're
You
good
ain't
right
getting
there.
him in one.
Man,
You ain't getting it.
I don't know what's
Okay,
causing
take
all
some
that
good deep breaths.
scarring
Come on.
and itching back
She
there.
said,
A
take
little
a
bit.
deep breath.
They offered him.
The boss is speaking over here. She's been quiet the whole visit.
I just listen.
Cough if you have to.
Pardon?
It's fine to
Deep breath
cough.
in, blow out hard. I want you to try and breathe in and blow out hard.
Do what now?
Deep breath in, blow out hard. Okay. One more time. Yep, alright, that's all I needed. Yeah, you got some wheezing when you do that, so prednisone may actually give us a boost.
But this is, everything you're hearing is symptomatic of COPD and.
Oh, she just said you have some wheezing, so it may, the antibiotic may help a little bit.
The prednisone, steroid.
Yeah.
Oh, that drug.
We don't need antibiotics.
I didn't go to med
You got
school.
enough of those.
She gave me enough and I said, petered out there, it lasts for.
Cause everybody's
Wow.
treated you for all the bacterial pneumonias on the planet, and that is not our problem, so we need to deal
Yeah.
with that. Okay, we have a plan, they'll bring in the paperwork, Tina's and Ty's phone numbers will be on it, so make sure you put them in your phone, because
Who is your nurse now?
Tina
Okay,
and then Ty is the scheduler, and their phone numbers will be on here along with the emails.
I talked to him,
Phone
and I
call, there's something
Lauren.
happens.
Laurie.
Yeah, Lauren abandoned me, she went to go work on the cardiology side.
Yeah, I didn't know why I might have, you said, well, she wasn't a
Yeah,
nurse.
she's still down here, but she's working on the cardiology side. She was actually a heart nurse before this.
Did she
so-
make more money that way?
No, she's
See,
just a
their
heart nurse.
dad, he was a retired nurse, and he was one of the AP or whatever, all
He's a
that.
paramedic. too.
Yeah, but he's working at a golf range, making $12 or something. Somebody asked the other day, well, I bet you go over here and make $20. You think I'm doing this for the money?
He
I
does it
want
'cause
to
he
where
golfs for
everybody
free.
happy all day long.
Well, he was gonna stay at RN, and then COVID hit, and he's like, I'm out. I retired.
Yeah.
A lot of
Yeah.
people did.
Mhm.
A lot of people did exactly that. They said,
Are you leaving
no
me?
longer worth it.
Are you leaving?
Yes, sir, I'm
I
leaving you.
gotta have
I got other
I gotta have
patients to see today.
Before you leave, even if I have to pose to you, so. Thank you, man, appreciate you.
You're welcome. All right, my friend, hold tight. Let me get my nurses. We'll be all good.
10-4.